In this podcast episode, Dr. Robert Lustig, a pediatric endocrinologist and author, delves into the intricate relationship between processed foods, sugar consumption, and the rising rates of chronic diseases. He argues that the food industry, particularly through the proliferation of ultra-processed foods, has significantly contributed to the obesity epidemic and related health issues. Lustig emphasizes that the true cost of unhealthy food choices is not just borne by individuals, but also by society at large, particularly through healthcare costs funded by taxpayers. Lustig begins by highlighting the externalities associated with the consumption of ultra-processed foods, particularly those high in added sugars like fructose and glucose. He points out that 62% of healthcare dollars in the United States are funded by the federal government through programs like Medicare and Medicaid. This means that when individuals become ill due to poor dietary choices, the financial burden ultimately falls on taxpayers. Lustig challenges the notion of personal responsibility, arguing that the concept has been manipulated by the food industry to deflect blame from themselves. He traces the origins of the idea of personal responsibility back to the tobacco industry, which used it as a defense against lawsuits related to smoking-related illnesses. A significant portion of the discussion revolves around the detrimental effects of sugar, particularly fructose, on metabolic health. Lustig explains that fructose is a mitochondrial toxin that contributes to the development of various chronic diseases, including type 2 diabetes, hypertension, and fatty liver disease. He emphasizes that the consumption of sugar leads to the accumulation of fat in the liver, which is a primary driver of insulin resistance and metabolic dysfunction. He argues that the food industry has successfully marketed sugar as a harmless ingredient despite its toxic effects on the body. Lustig challenges the widely held belief that a calorie is a calorie, asserting that this notion is fundamentally flawed. He explains that different types of calories have different metabolic effects. For instance, the body processes sugar differently than it does protein or fat. Lustig provides examples, such as almonds, which contain fiber that reduces the number of calories absorbed by the body. He argues that the focus on calorie counting oversimplifies the complexities of nutrition and ignores the biochemical processes that govern how our bodies metabolize different foods. The conversation shifts to the impact of ultra-processed foods on public health. Lustig notes that these foods are often engineered to be hyperpalatable, leading to overconsumption and addiction-like behaviors. He cites studies showing that increased consumption of ultra-processed foods correlates with higher rates of obesity and chronic diseases. He emphasizes that the food industry has a vested interest in maintaining the status quo, as processed foods are more profitable than whole foods. Lustig advocates for a comprehensive approach to addressing the public health crisis caused by processed foods. He suggests that the government should take a more active role in regulating the food industry, similar to how it has addressed issues related to tobacco and alcohol. He points to successful initiatives in the UK, where the government worked with food companies to reduce salt content in processed foods, resulting in significant public health improvements. He believes that similar strategies could be employed to reduce sugar content in foods. In addition to regulatory changes, Lustig emphasizes the importance of education and mindfulness in making healthier food choices. He discusses the need for individuals to understand the impact of their dietary choices on their health and the environment. He argues that by educating the public about the dangers of sugar and processed foods, individuals can make more informed decisions about their diets. Towards the end of the podcast, Lustig shares his involvement in a project with the Kuwaiti Danish dairy company, where he and a team of experts work to reformulate their products to make them healthier. This initiative aims to reduce sugar content while maintaining taste and appeal. He explains that they developed a framework for re-engineering ultra-processed foods, focusing on protecting the liver, feeding the gut, and supporting brain health. This project serves as a model for how the food industry can adapt to meet public health needs without sacrificing profitability.